all of your antihistamines, all of your decongestants, what they are designed to do is dry you out. And I tell patients, your eyes don't live on an island. So a lot of patients will have different things that they do throughout their lives. They always ask me, what can I eat? What do I take? And they think their eyes aren't going to be affected. So antihistamine, decongestant, your diuretics, so most of your hypertension medications, as well as a lot of medicines that you take to manage some of those autoimmune conditions can dry your eyes out. Most of your antidepressants, antipsychotic medications, they affect your tear film. And so really it's a gamut of medications that most Americans take throughout the day, whether they're prescribed or over the counter, can potentially cause harm to the tear film. So that's why it's very important when you have a regular routine exam to bring your medication list, to understand what medicines you're taking, what dosage you're taking those medications. Because sometimes an elevation in dosage may cause the tear film to be disrupted or no longer balanced, and you begin to have dry eye symptoms. And so I usually tell patients, we have to live, right? And so we have to get everything to work together. So if you have to take a certain medication to keep your blood pressure down, to manage your autoimmune condition, we're not going to stop that medicine, but it's important for me to know so that we can manage the symptoms or the disease state that may be a manifestation from that medication. So in our case, dry eye, or meibomian gland dysfunction, so that we can treat you so that your eyes stay comfortable. But it's more medications than not. And then it's the longevity. So the longer you take those medications, and then it's the polymedication. So sometimes you just take one medicine, maybe not. But if you're taking 10 medicines at one time, there's a very high probability, just because you're taking so many medications, that you can start to have some issues with the tear film, which is going to result in the dry eye symptoms. So key from that is know your medication list, know your dosages, save it in your phone, and take that every time you go to the doctor. If you come for different visits throughout the year and medications change, then it's important to have that medication list updated.